The patients that first visit our hospital first time, they always say that they have been treated like a king. I think it's like when you're buying a shirt, there's no one size fits all.
Next month, they came with a lawyer.
Oh God.
Sue the hospital and the doctor because they don't inform about the alternative way. Our job is to provide the information for the customer.
We know who's the best in this position. We know who is the best in this surgery.
We try to do our best for the customer, but sometimes we cannot know the result. We hope for the best, but prepare for the worst.
Welcome to the Thaiger podcast. In today's episode, we'll be discussing the importance of seeking a second medical opinion and what makes Thailand a leading destination for medical care. Dr. Chokchai and Dr. Sarit will share their expertise on how Allied Health Thailand offers comprehensive services and supports patients through life-changing medical decisions. Welcome, everybody, to another episode of the Thaiger podcast. I am joined again by some of the experts from Allied Health Thailand. That is Dr. Chokchai and Dr. Ip over here. Can I ask you very quickly, Dr. Ip, to introduce yourself?
I'm Dr. Sarit Suwanakijboriharn. You can call me Dr. Ip. I work as a general surgeon at the Bangkok Hua Hin Hospital. In Hua Hin.
All right, so some knife jockeys in here. And Dr. Chokchai, just a brief introduction again of yourself.
It's hard to say brief because of a long story. I work for the government hospital for roughly around 20 years, and after that joined with private sector at Bangkok Dusit Medical Service Company. Roughly around 20 years, and after retire, I be a surgeon. Still be a surgeon and admin of the heart center, director of another chain, and set up this company too. Try to find the right healthcare to the customer that they need. That's all.
See, and when you've been
training a heart surgeon by train.
Yeah. So you guys have been using the knives plenty of times, right? I love it.
Yes.
Yeah.
One way of when we train, the most important part is not focus on using the knife. Is focus on how we can avoid the knife use it.
That's yeah, and I think there's so many advancements these days that you're getting less invasive.
Minimally invasive.
That's
in technical term.
I like that.
Yeah.
I remember even myself, like we're going to talk about some personal stories a little bit later. But actually, before we get to that, let me ask you guys quickly, because one of the topics of conversation I want to get into with you is, and it's a good thing I have two of you, because I want to talk about getting a second opinion in the medical industry. Why do you think it's so important to seek out second opinions when you're going for medical treatments?
Yes. You need to know first, this is a customer right or patient right. They need to know which one of the treatment is the best way. But not only that, they need to know what is another way of the treatment, success rate, possible complication, length of the stay in the hospital. That is our second opinion too. Most of the people or most of the doctor in Thailand, they're familiar with give the customer about the planning of the treatment only one way. Mostly they don't concern about the alternative of the treatment for the customer. The alternative is the second opinion. We try to provide all the standard information about the investigation or treatment. And if they not want to be like that, what is another way of the investigation of the treatment?
Well, I'm sure I highly respect your opinion, but sir, excuse me, I have to ask a second opinion over here. Dr. Ip, what do you think about the subject?
I think it's like when you're buying a shirt, there's no one size fits all. You can come to a shop if it's like a style that you like. If you only one shop that you go in, you only get one style. You might not know that there another style that you might prefer. It's same in the medical. You go to the first doctor, he might give you just one option that he preferred, but you might not know that there's another option.
I think that's very well said because, like with shirts, I think most of us can, look at many things and form our own opinions about what we're looking at. But when it comes to medical treatments, we're not experts, right? Most people are not experts. So we will defer. We'll think, oh, this guy, he's a doctor. He knows what he's talking about. But then there might be another doctor that has a completely different opinion on this. So then that brings up the obvious second question then. How, as a patient, how do you decide which opinion to listen to when it comes to these treatments?
Normally, we need to focus on first treatment or investigation standard. What is the way of the best treatment outcome? The alternative may be if they don't want to be like that, what is the another way and what is the success rate? That means our responsibility or our job is to provide the information for the customer or the patient. Which one is the best and what about the opinion of the physician? And the family and the patient will decide by themselves after have all information. That's all.
So important to just get the information, then
Right.
Eventually it's on you. You have to make the decision yourself. Yeah. You have thoughts on that, Dr. Ip?
Yes, our job is to provide the information. But who decides? The patients.
That's that's difficult though, because like I said, many people don't really know. So that's part of your services though, right? At Allied Health Thailand, you provide a second opinion just built in with your treatments. Yeah.
Right now, all information is more easy to find. Just only on your tip of the finger. But sometimes need experience that the internet cannot tell you like that.
That's actually it's something I did like a full body check, right? Like I did the full body thing at one of the hospitals here in Bangkok. I love. I have a very good experience when I go there. They give me all of my results. They email me my results. You know what I did with those results? Of course, I sat down with the doctor. She went over it with me. But then I took those results, put them into ChatGPT.
Yeah.
Yes.
And used AI to see, okay, what do you think about this in ChatGPT? And mostly the same things. The second opinion there was pretty similar to the first one. But do you think, how trustworthy is the internet? Can people use these tools like artificial intelligence to help them to make more informed decisions?
Yes. Our responsibility is to confirm the information, maybe from the internet or anywhere else, to make sure that the information that we have is the right way. First, back to the test result. When you test something, you need to know that first, accurately of the test, high or low. Secondly, if the test show normal, that means two-way. First, normal.
Yeah.
Secondly, abnormal but cannot find the result from that test. That is the way. If the result is abnormal, is make sure that it's abnormal. Some people get the result that is normal. It will be stick in their mind that it's normal, but maybe not normal.
And obviously your health changes over time, right?
Yes.
As you get older and your lifestyle changes,
Right.
your results will not be the same the next time you go in.
I will tell you some story. My customer, my patient, roughly around 40 years old, is a high rank of the admin. They plan to visit another country in Beijing, from Thailand to Beijing.
China, right? Yeah.
China.
Yeah.
They're concerned about their health a lot. Regarding to WHO, World Health Organization, they suggest that about the heart, just only exercise test. That's all, and the result is okay. It's good. Nothing wrong about the result. When they go to China, 2 days after visit, they stay in the hotel room and suffer from the chest pain. That's mean about 6 hours. The group went to his room and bring him to the hospital and suffer from the heart attack.
At 40, right?
Yes,
Wow.
yes.
Such a young age.
Because of the language communication problem, the heart function reduced. That means result to treatment is very long time. Heart function reduced from 65 to 85% to 40%.
Scary.
That is scary. So this is the reason why the normal test cannot tell you anything about the result at all.
So, what could he have done differently in that situation?
In the situation, is depend on how they concern. The WHO based on health economic that mostly of the customer do the exercise. It's okay, but for me, we have technology a lot. As I told you, X-ray computer can help because of 70% of the customer that come to the hospital because of rupture of the soft plaque in the heart vessel. That cannot check by stress test. And X-ray computer can find. That's all.
So there's just new technologies available that allow us to do more thorough checkups, things like that. Anyways, Dr. Ip, I'm curious to know, have you had any experiences? You're a general surgeon, right?
Yes.
So have you had any experiences with patients that that surprised you, I guess, when they came into you for, all right, doc, I have like something wrong with my back or something wrong here, and it was a completely different situation than they thought?
More like let me see.
It's okay. Yeah. I'll ask you. You're based out of Hua Hin, right? Now, what kind of customers do you usually serve down there? Patients do you see?
50% foreigners and 50% Thai, and mostly my patients that I do operate is like gallstones.
Gallstones.
Yes, I have one patient that visit my hospital multiple times because of the pain of the gallstone, but he didn't want to do the surgery then. He will go back to the US in the next month. He wants to do in the US because it's more familiar.
Sure.
Yeah, but after like 3 attacks, he visit, check it out, doctor.
Yeah, I mean, you can't ignore the problem, I think, because it only gets worse and worse. I had a friend of mine, speaking of China, I was in China, and he had appendicitis and, just abdominal pain. He's like, I hope it goes away. I hope it goes away. And it does not go away. Could have been very bad. Ended up being a very expensive surgery that he had to undergo. And the surgery did not look good. I'll just say there's a very deep hole scarring right in his tummy now. And I know other people who have had appendicitis and look totally fine afterwards too. So what is how would you recommend patients, if you're feeling some kind of symptom, look, some things go away, but other things do not.
As you said before, the AI. I have a patient that consult me because of in the CT scan, suspected an appendicitis, 3 cases last month. I did not do the operation on the 3 patients. They are fine because not all appendicitis can only see from the CT scan. You need to do the history taking, do the physical exam, and the X-ray. If you just look in the CT scan and do the operation, you might do in the patient without appendicitis, even though the results said that appendicitis.
Yeah. Is this a big problem, like in the industry, where people do unnecessary surgeries?
Right.
Yeah, it is an issue. How do you determine? Where do you make that determination whether this is going to be too invasive, or is this something we can deal with without going under the knife?
That's the art of our profession.
Yes. One story, maybe another issue. One of the customer came to the hospital because of pain in the belly pain, and one hospital cannot find something wrong. Let the patient back home, and they still have pain. They come to another hospital. After 2 days, they send the X-ray computer and find out that is the appendicitis. The most important part is the patient went to the operating theater and did appendectomy already without any complication. And they went home after 5 days of the surgery. Next month, they came with a lawyer.
Oh God.
Sue the hospital and the doctor because of they don't inform about the alternative way of the treatment. Because of you know that the alternative way of the appendectomy is open small incision and remove the appendix. Another way is by using the scope, keyhole surgery. They don't mention about the keyhole surgery at all.
So is there a legal obligation, right? They have to provide the options for you at least. So talk about the second opinion. There.
Decided the hospital and the doctor pay $2 million for those guys.
Rough.
This is a example of the second opinion or alternative of the treatment.
So it's not just
It's more important.
right. It's not just a good idea. It's required, right? Like you absolutely need to do this. That is strange to me though. Like, were there any complications from that surgery? Like, it was purely because they didn't give the second opinion that they awarded that money.
They need to provide the information about first the way of the treatment first, the chance of the success, possible complication. 1, 2, 3 hospital stay. Need to know them all. Let provide them all about the mainstay of the treatment, including the alternative too. And after that, if they provide that and record, record it is very important.
The medical history, right?
Right.
That's very important. How
Written the record.
Right. So when you look at patients, how important is the family history? Like when it comes to assessing, symptoms, like say there is, some heart condition, something like that. How important is it to understand the family history, or is it just okay to treat each one individually, or do we need more information about, say, the father or the mother? What do you think, Dr. Ip?
It is part of the history taking. Like in breast cancer and in colon cancer, it could be from the genetics. So it's play a major role. If their parents have like breast cancer or colon cancer.
There's a family history, then you're more likely.
If we see anything abnormal, we might raise more suspicions than other patients.
Yeah. Well, what do you see? How much of it is genetics when it comes to a lot of these issues? How much of it is lifestyle, the way that people are living their lives?
For me, normally, the technology for investigation is good and developed a lot, advanced a lot. We can predict which condition that you suffer in the future. But currently, we know that the genetic testing or predict the future is just only 20% of the condition. 80% is depend on environmental. It's depend on the way of life, activity, and everything. That's all. This is a good way of the what we call preventive medicine. We can predict this guy have high risk of the heart, such as a heart condition. So that means we can advise them to be a good activity, early checkup. That's all. That's all.
So yeah, preventing is
more important.
Yeah, absolutely. The costs are lower when you're
Sure.
preventing
Sure.
than you are when treating these things. Yeah. So there's a lot of people are looking for miracle cures, right? Like, have you seen the rise of, say, Ozempic, for example, as something that people are using for weight loss treatment? But at the same time, the benefits of Ozempic will fall off when you stop using it. So it's almost like a subscription service. What do you guys think about these kinds of? I would say, I don't know. Are they just fashionable now? Are they something that are here for the long term? Are they legitimate answers, or should people take more responsibility?
For me, I think there is no shortcut in life, in health. You need a consistency. Like working, you need to work consistency. No shortcut. If you do like Ozempic, you might have a weight loss for 3 months, and after a year you gain weight back.
Put it back on.
If you have no consistency in the diet control, in the exercise, like 90 patients have gained their weight back.
Yeah, that's an issue, I think. But you can understand, though, it is so attractive, though, right? For the average medical consumer to be like, okay, I can't diet, exercise isn't doing much. What? All of a sudden, magic injection. How do you battle that? Like, how do you, like, saying no shortcuts? That's great, but I mean, a lot of people want those shortcuts. So, what do you think, doctor, about advising patients? How do you convince them to make healthier choices?
The medicine is art and scientific equal. As I told you before, that our responsible is to provide the information. That's all. And after that, right now, it depends on the customer. After know everything about their condition and the way of the treatment. I never convince them to do anything.
Just let them have the information and then
decide by themselves after all the information that they need to know.
Yeah. Do you want to live longer? Okay. Do this, maybe. Well, that's
consistency and discipline is very important part.
That's the
of the
difficult
living.
part.
And most difficult too.
Yeah.
Mostly of the patient of the customer need have a short-term result, an easy way.
Yeah. A lot of it too has to do with diet. So, for example, okay, I love street food. I go for some street noodles and stuff like that. One time I was there, and I saw this young Thai like teenager, something like that, a little heavier, and I watch him. Okay, I'm eating my boat noodles. He's eating his too. When he takes his noodles over to the area where there's sugar, and he just starts pouring lots and lots of sugar into his, for me, I would never put any sugar in there. But it seems like there's a lot of, people's, the food that we eat is presenting a challenge, right? Fast food it's cheap, it's easy, it's accessible. Eating healthy seems more difficult these days.
More expensive.
Yeah. How do you find ways to challenge? How do you eat? I guess let me ask you that. What are your ways of maintaining your health?
I think eat like diversity, and just pick not too fatty, not too much carb. I think that's all. I'm not too strict in my meals. I like to enjoy eating.
How about you, doctor?
Me too.
Yeah.
Go to the middle way.
Moderation.
Yes,
right?
moderation.
That's the thing. Yeah, I think a lot of people get stuck on these fad diets, right? Like these diets like, oh, I only eat meat, right? No carbs at all. And that will help me to lose weight, something like that. Yeah, what do you think? Are there any effective diets that you've seen that people can engage in or that you recommend for people? I guess not. You guys are saying, just make sure moderation.
Actually, everybody know what is the best component food that you need to have. You need to have more vegetable, meat. Try to avoid red meat or something like that. The carbohydrate is a good component, but if you decided to adjust the food, you need to adjust many things too. Adjust the food, exercise, everything. For me personally, in the morning, I have breakfast with normal meal. In lunch, maybe less carbohydrate. In the evening, maybe no carbohydrate, just only meat or vegetable and some alcohol.
Most important part of the meal. But yeah, that's so I think what you're saying is maybe that you should have a plan, right? Like
Yes.
some kind of plan in place. Like don't just eat nothing but fried rice all the time. You need to make some diversity, I think, as you said. Well, cool. Well, let me. We've been off topic a little bit. Let me get us back on topic now. Allied health, guys. You guys have all sorts of different. You place an emphasis on specialization. Now we have a heart specialist over here. We have a general surgeon over here. How much of a difference does it make when you are trying to treat these patients' symptoms to get them to see the right doctor, to go through the right treatment plan? Is it possible to have more general doctors to be able to diagnose the situation, or should people be seeking the specialist attention every time?
Right now, the current situation of the customer need to find out which is the specialist. The general practitioner is good for the family doctor, treat about the basic, but the customer come from abroad. Mostly they have specific symptom or specific condition, need specialist to advise and a treatment at all. It's be like that.
Yeah. So as a general general surgeon, I guess, like, do you ever come across patients where you would maybe refer them to someone more specialist?
So we know who is the best in this disease. Like in football, we know who is the best in this position. Even though they're in the Premier League, the same division, but we know who is the best in this surgery, who is the best in this surgery.
So, and I think that's a big point of like more general medical practitioners is that, okay, here's a problem. I can see it's in this area and I can refer you to somebody who will be able to help you more effectively. So is that something that you guys offer at Allied Health, like trying to just channel people, bring them to the right
track?
Cool. Beautiful. Now, I can tell from your metaphor, I'm going to go off topic a little bit. You're a football fan.
No.
No? Okay, never mind. Not me, but anyways.
I like to play sport, but I don't watch sport.
Oh, fair enough. All right, yeah. Don't worry. I don't watch football either. I'm a Muay Thai guy. Yeah. Talk about, I guess that's, do you guys watch Muay Thai ever?
Some,
yeah.
Yes.
Big fan. I'm a huge fan. And I just think about these guys that are putting themselves through, of course they do amazing training all the time, but they also go through punishment, right? Like, I don't know. What do you think of just the whole practice of Muay Thai? There's so much tradition here, but also there's a lot of risk to your own health when you go to it.
I think Muay Thai is a very dangerous sport. And you need to know well about how to use your body to protect more than to fight.
I see this all the time. Like, so I love to watch these sports, MMA, that kind of thing. If you see MMA, they fight maybe like 30 to 40 times in their career. In Muay Thai, it's like more than 200. You see people like Sanchai, Boakao, and
they started young, like 12.
They start young, but also they fight frequently. They do many fights per year, and I think it comes to what you said. They know how to protect themselves more, I think, and they know how to train properly so they don't injure themselves there too. Sorry, just an interesting topic, I think. Talking about Thailand, because what I want to ask you next is what makes Thailand so special? Why should people choose coming to Thailand for medical tourism?
From my experience.
Your side.
You first, then you.
With the patients that first visit our hospital first time, they always say that they have been treated like a king, multiple patients, because I think our hospitality, our fast in service with our standards, international standards, they are happy.
I mean, I know that I've experienced that in the hospitals here in Thailand. And it's something I think coming from Western society, we have this idea of like, oh, we have the best especially America, right? Where it's so expensive, right? Medical care is so expensive, but we still consider it the best, right? We think of it as the best in the world. But yeah, when I come out here, I feel better than when if I'm in America, I have to sit around waiting in a doctor's office for 2 hours before somebody wants to see me.
Yes.
And then when they see me, it's like, okay, hey, how you feeling? I'm like, wait, I don't know. You're the expert. But here in Thailand, I feel the quality is definitely much higher than we would expect. Coming from, we think, oh, Thailand, maybe it's developing nation, something like that. But when you go to the hospitals, you see it is absolutely still world class. Do you have anything to add to that, Doc?
Yes. Except the issue of the standard of service, except the standard of treatment, as you told, the way to go to the hospital is very, very fast. It's more easy to access the doctor first. Secondly, they always give you the opinion for another kind of treatment. Thirdly, the cost of the treatment may be different. If you compare in the United States, Australia, Singapore, Malaysia, Thailand, higher standard, but cheaper than nearby country, as I told you.
So a little bit of the best of both worlds there.
Yes.
You don't have to go into debt and like so many people in America have to do. And not only that, okay, how about let's talk maybe insurance then. So your services, do you usually work with insurance companies
Currently, no. But the hospital friend, they already have work well with the insurance company. That means the patient can use electronic reimbursement with the same day before you back home. It's more easy.
So you can help to match up people with insurance plans with hospitals that will accept that coverage and that kind of thing.
You need to check the policy of the customer before you contact the hospital.
That's an important part of the job. I imagine you don't want to make that mistake, especially if you're trying to find these hospitals on your own. That's a lot of research you have to do. You guys already have that information. Okay, so we mentioned earlier shortcuts, right? And how many people are trying to find shortcuts. What do you recommend, since you guys are both surgeons, there are these surgeries where people, can use them to lose weight, like gastric bypass, the balloon thing?
There's steps of the invasive. First step is diet, we all know. Diet, less weight. And then Ozempic, medicine. If you fail, we have endoscopic balloon. We blow a balloon inside the stomach. Then you can't eat anything. You can eat just 3 spoons, then you are full. That made you eat less. If it still fail, we can do the gastric bypass or sleeve gastrectomy. We cut out some part of your stomach. So it's less volume, you can eat less.
Is this ever something that you recommend though? Have you ever come across a case where, okay, nothing is helping this person, we need to do this?
We found that the Ozempic and with diet control, we 90% fail in 1 or 2 years. They have to make a big change, like a surgery in their life, so they will maintain the weight more.
Wild stuff. Have you ever had experience with this with any patients of yours?
Unfortunately, I have heart surgery. Surgeon, not involved for the weight reduction, but as Dr. Sarit told you, the way of the treatment is start from less invasive, step up, if it fail. But the most important part is you need to provide this way of the treatment. How many percent of the success? How many percent of the recurrent or getting old? And fat again.
Yeah. Yeah, coming back into it. I mean, obesity plays a
obesity,
big. It's
yeah.
a big part of heart health too. So it's. I mean, where I come from,
Actually,
Yes.
even balloon or bypass surgery is treated at the end result. The primary cause you need to treat too. The weight need to reduce the weight, whatever way, by Ozempic, by balloon, endoscopic balloon, or by surgery, and after that monitor the outcome and evaluate. Before that, you need to completely evaluate your health first, mostly heart, brain, lung, or kidney, or liver. That's it.
What are some of the markers then? Like, say somebody goes and gets some blood work done, right? Like they get some test results back, cholesterol levels. What are the markers that people should look for that are most important for their health?
The marker is not from the blood first. It mostly from your health first, such as a weight, height, gain, or something like that. Secondly, after investigation, the blood work is okay, but if you need to pay attention at the heart condition, the cholesterol level is very, very important issue. You need to focus on the moderate level, not too high, something like that. And you know that the cholesterol, the lipid in your blood composed of cholesterol and triglyceride. The lipid in your blood may be rise from two factors. First, you take a lot of high lipid, so for sure it's increased. Secondly, the lipid in your blood may be produced from your liver. That means somebody has lean body, skinny, but high level of cholesterol. That way you cannot control by diet. So that means you need some medication to control the lipid that the body produce it.
Interesting.
That's all.
Yeah,
It's a little bit complex.
Yeah, sounds like it. It's medicine. There's a reason you guys study so long for that.
And so hard to
Yeah.
yes, give away my teenage university life.
Oh, I know those best years. But no, it's important though. Like without you guys studying and pushing the science and bringing us into the future, I think, of medicine, making sure we all live healthier lives. It's a big problem. In America, for example, so I know I keep going back to that. I imagine many Americans would be interested in your services here. Our life expectancy has been going down. It has been declining in the past several years. And there's many aspects of that. There's mental health aspects, right? There's a lot of self-harm, things like that. There's obviously obesity is a big issue that we deal with, and that leads to that underlying condition leads to all sorts of other health complications. What do you think is like? Do you see people being resistant to the future of medicine, like these new technologies that are coming out to make your jobs easier, make it easier to diagnose people? Are there people in your profession that no, we like the old way of doing things, or are most people open to the new technologies and new processes? What do you think, Dr. Chokchai?
Yes.
Yeah.
Mostly, as I told you many times about the customer or the patient, our responsible or our duty is just only provide the right information.
Right.
First, in medicine, prevention is better than treatment.
Yeah.
That means early detection or annually checkup is very important part.
Well, actually, hold on, I'll cut you off. What I meant was actually medical professionals. Are they resistant to the changes that come? Obviously, part of medicine is continuing education, right? You have to keep learning and pushing through things. Is the field open to new ideas and new technologies, or are people more closed-minded sometimes?
Yes. Frequently, I found a guy like this. As I told you back that our duty is provide information.
Mm-hmm.
And if they don't want to do like that,
Mm-hmm.
it's okay. But another advisement is come to the early check
Mm-hmm.
frequently.
Mm-hmm.
Try to avoid the risk factor.
Mm.
Try to early detection of the abnormal thing that happen to your heart, to lung, to brain, and everything. That's all. This is only way, I think, is the way of the provide for the customer.
So I guess what I want to ask then is, how do you discern? Because you guys work with many different medical institutions and professionals around Thailand. How do you discern? How do you choose who is a good partner for you to work with and who is not? What are the things that you look for when you choose partners?
The society of the doctor is very small.
Mm-hmm.
So we know mostly of the physician in Thailand. As I mentioned to you, I'm training a heart to be the heart surgeon.
Mm-hmm.
Right now, only 300 surgeon in Thailand. That means we know everything.
Wow.
Secondly, from my career, I'm used to be the director of the heart surgery of Thailand.
Wow.
For a period of time. That means we have connection to know which one is good or which one is fair.
Fair.
Something like that.
Very diplomatic answer from you right there. Yeah, that's the range. It's fair to excellent. That's wonderful. Very small community, right? And it's
Very small community.
It's
Yes.
nice that you guys are. It's tight knit and everybody knows each other. So, yeah, word of mouth is important as well.
Yes.
Well, Dr. Ip, I want to ask you a question. You've worked with many international patients based out in Hua Hin, right? Yeah. Do you have any interesting stories, some success stories from some of the people who have come in for your services?
I think they just love how we treated them in the hospital, like fast service, with standard care. They're happy in their hospital. They're happy with the doctor, with the nurses, with the food. I think that's the best the experience. The experiences.
Yeah, coming from the West, we have insane waiting times. Like that is a big issue for us when we consider, medical treatment. Like we expect it, right? We just whether it's the UK with the NHS, whether it's Australia and their Medicare system, America as well, we don't expect fast service. So I think when they arrive and you see in Thailand, I remember when I did my full body check at one of the hospitals here, it was like lightning rounds. I was like able to just go here, do this work right here. And that is a big selling point. I think that people don't have to wait around for a long time to receive the care that they need. So, yeah, wonderful. And yeah, do you have any interesting stories of patients that have come through?
Interesting story or?
Maybe you can do both. Let's start with success first.
When I joined with the private sector about 30 years ago, at that time, I think the problem the Thai community is difficult to seek the health care at that time. At that time, but currently, the customer or the patient can easily approach to the healthcare facility first. Secondly, the most important thing is we try to do our best for the customer, but sometimes we cannot know the result of the treatment. For example, I found the patient that need to do the bypass surgery because of heart problem. Two customer, one in the same condition, heart function is okay, planning to do the operation be the same. Risk of the operation be the same. But one guy can early discharge from the hospital, maybe 5 days after the surgery. But another one may be occurring complication that made the patient need to stay longer in the hospital because of we treat about the patient. You treat a human that not be the same at all. may be different the patient by patient. Even the same condition that need to do the surgery, even they do the surgery in the same way, but we cannot predict.
It's very individual, right? Each
Yes,
of these
very,
cases.
very individual.
Yeah. That's difficult. That's the difficult
Yes,
part of the job, man.
the most difficult part for me is try to accept the result. We hope for the best, but sometimes the result may be not for the best. That's mean hope for the best, but prepare for the worst.
Right. And that's why you make such an emphasis on, prevention rather than they should be addressing the issues before they get to you, I guess. But not everybody is, not everybody has those habits developed. I do want to ask, what do you guys think of the future of this industry, the medical tourism industry in Thailand? Do you see it growing? Do you see it becoming more influential in the world?
Thailand is a travel destination. Now it's just moved to medical because we have high standard, international standards, and they can visit after they do like surgery or finish their medical. They can travel in Thailand. Most my patients, they wanted to do the surgery in Thailand rather than their country because it's more convenient.
Can you tell me about so say somebody comes for some surgery here. After this surgery, what can they do? What are some interesting things that they can do as a tourist here who is also recovering?
I think they can enjoy the, like maybe a spa or our food, our culture.
Thai food is world class. I do love that. And the wellness retreats too. Do you guys have partnerships with wellness retreats and spas? Yeah.
Yes. We have, as I told you, that we have a close friend that work for a wellness retreat in Chiang Mai or Phangan, Thailand. For the future of the healthcare industry in Thailand, for sure, I think the healthcare industry in Thailand is world class. The quality of the treatment is okay. The cost is not so expensive compared with many countries. The service facility in non-medical field is okay, it's very good. But the company vision is try to make a bridge. Get the patient from abroad to choose the best one for him. That's all. It need to create the road, bring the customer here in Thailand.
Yeah, I think Thailand does a good job of selling itself, right? But I think many people are still wanting to learn more and understand this concept of medical tourism. Of course, there are visas set up specifically for this, for these processes. But if I live in Thailand, so I have more of an understanding. But so many people visit Thailand just for a few weeks, just a couple of times, might not know that this is a very real and very good option when it comes to these procedures. Especially what are you saying? Dental cosmetic surgeries that are obviously incredibly popular amongst Westerners and other people who would like to travel for that. And not only that, just the environment that Thailand provides is just a lovely change of pace for so many people. Well, guys, we're almost about to wrap up. I just want to ask you any final thoughts, any advice that you would give for somebody coming from abroad to seek your services. What would you say?
Always ask for second opinion when you decide major things in your life. Always ask for second opinion.
Cool.
Yes. Yes. When you decided to come here in Thailand, try to seek the treatment or the wellness. The thing that you need to know is which one is the best by provide the information from standard. That's all.
So
They need to have some smart idea or smart way to come, not just to come and walk into many hospitals without the idea.
So that's one of the beautiful things that you guys can offer, a consultation before you even get on the plane,
Yeah.
so that people can come with a direction and a goal in mind, rather than, oh, where am I supposed to go? That's wonderful. Well, thank you both so much for joining me today. Let me wrap this up and then I'll say goodbye. Guys, anybody who's seeking the medical tourism route here in Thailand, Allied Health Thailand has all the options for you. They're able to bridge you with your needs to the proper services all over Thailand. Am I right? Yeah, and provide you with that second opinion that is so important when you're seeking these major medical, making these major medical decisions. So, Dr. Ip, Dr. Chokchai,
Yes.
Sawadee Kap.
Oh, สวัสดีครับ
Thank you very much for coming.
Welcome.
You're welcome.